Welcome to all who are watching as we gear up for the upcoming 2024 KLAS Digital Health Investment Symposium, also referred to as DHIS. This event will be held September 10th and 11th in Park City, Utah, at the beautiful Stein Eriksen Lodge. This summit is proudly sponsored by some of the leading names in the healthcare IT industry, and we're grateful for their long-standing support of DHIS and for joining our panel today. With me are Clare Barnes of Tree, Alya Sulaiman of McDermott, Well and Emery, Walt Brickell of the Marwood Group, and Doug Greenberg of Korn, Ferry. We have 7 panel topics that we'll be delivering at this year's symposium. I would like to discuss a handful of those today, why each of you have had a chance to review and digest all of those topics, and I'm sure could offer thoughts on several of them. I would like to ask each one of you to just select one and offer some thoughts on why you feel that topic is so important and why it really matters. Maybe even why it matters more today, more than ever, in today's setting and landscape.
Thanks, Justin. You know, I think for me, one of the most important topics that we'll be touching on at the conference, and frankly for this year and for the next 12 to 18 months forward, is really around patient conversion and engagement. You know, the way that I view it is patient engagement is an essential component for thriving in a value-based care environment. And frankly, I think it can make or break the success of a practice, you know, and patient conversion and engagement really enables the success as we enter into a value-based care environment. And what does success mean, or how do I view success? Now, I would define success through several different dimensions. It's first and foremost the patient experience, right? It's supporting our clinicians that are driving the superior outcomes. And it's ensuring that we have enabling our practices to be profitable. Where we are at in this moment in time, we have a tremendous amount of learnings that we are garnering coming out of COVID, right? You know, how to engage and manage care, how to engage with those patients in a virtual way, how to maintain engagement with those patients, not only when they first come into our practice, but how are we caring and engaging with those patients as they leave our 4 walls and, you know, march through their care continuum or their various needs after that initial visit. There are so many pressures in our healthcare ecosystem around labor and workforce, burnout, reimbursement, patient retention. I think these pressures are honestly the very reason why patient engagement today is essential, and figuring out the tools to success, the technologies, the automations that underpin how we are moving patients through our ecosystem and through our practice will become, you know, a vital part of the value-based care conversation. You know, one of my favorite stats right now is, you know, we know that 70% of Medicare beneficiaries suffer from at least 2 or more chronic conditions. Yet what are we doing to maintain that regular dialogue with those patients, making sure that they are getting the care that they need? I think this is where patient engagement comes in, right? Maybe if we focus on one particular subvertical around digital front door, I think that we've all have a good understanding of how those tools continue to drive the patients into our practices, or how those patients are finding the specialists that they need. But what are the tools to ensure that patients are getting the regular care after that initial visit? You know, what do those tools look like? How can we augment those tools with automation or AI, or, you know, doing things in a labor-light manner? And so I think having these discussions at the upcoming conference, connecting different perspectives, is really what's going to help facilitate and optimize, you know, a good path forward, and what do those tools look like for success.
Thanks, Claire. Yes, and that really ties into the theme of DHIS, and you hit some of those as health systems are facing, you know, margin pressures, hyperinflation in many ways, labor shortages that you touched on, and then again, we're still, you know, several years removed from the pandemic, but again, still having an impact and ultimately how we navigate. It's more than scheduling at this point, so thank you for sharing that. Doug, if I could maybe hand off to you, what topic would you like to share some thoughts on? What stands out?
Yeah, I think something that's affecting all healthcare organizations today is cyber and the issues around cyber and cybersecurity. I think just the last 2 years alone, nearly 50% of all healthcare organizations have experienced a breach. The average cost of a breach in healthcare is higher, much higher than any other industry. Something else I saw was close to 50 million Americans were affected by healthcare breaches just in 2022 alone. So obviously we know, and you just talked about it, the various cost pressures hospitals, health systems, AMCs are dealing with, and they're sitting at the center of the healthcare system. And there's been challenges for many years, and all these competing priorities for dollars have really created a situation where these health systems have been unable to really put the amount of capital expenditures towards security. It just caused huge tech debt. So this increase in tech debt has created sort of less than ideal security infrastructure and tools. At the same time, there's obviously been a rise in cyber crime, and unfortunately, the gold standard of cyber crime is healthcare data. I think just a medical record alone is worth $250 in the black market. More importantly, I think what we just saw and all witnessed with the attack relative to Change Healthcare several months back, how quickly it can impact the system, right? Given the flow of financial payments between payers and providers, and specifically the cash flow. And it kind of brought the healthcare system to its knees, crippling, many, and all stakeholders for weeks and even to months. So I think just the overall question is, how and what can we do to protect healthcare organizations, and then obviously most importantly, patient data moving forward.
You're right, Doug. In terms of prior to 2 years or 3 years ago, the CISO was ultimately the one that was making the decision. But in light of the events that you've just mentioned, it has certainly prioritized the decision making at the highest level of these health systems. Alya, I could, surmise, just knowing where you spend a lot of time with your practice, what topic you might select, but I don't want to, be 50-50 and guess on the wrong side of the coin. So I'll let you go ahead and share and see if I'm correct on what you might choose.
If you were to say artificial intelligence all day, every day, you would be correct. So I, really enjoyed last year's discussion around separating the hype from the high impact when it comes to artificial intelligence, and looking forward to another series of discussions, including one great panel that will focus on what tools are actually emerging through the hype cycle to demonstrate real value and promise to solve what we all just talked about as the most pressing problems facing the healthcare system. People are getting sicker. By 2025, it's estimated that 49% of Americans will have a chronic disease. And by 2030, there's estimates that 21% of Americans will, be over 65 and entering a period of their lives where, care demands increase. And it's unclear whether our healthcare system today is poised to accommodate, many millions of new patients. When, I speak to healthcare organization leaders, what keeps them up at night is how to safely do more with less and shore up their economics. And there are a lot of artificial intelligence enabled solutions entering the market that promise to be able to help them do just that. When it comes to staffing shortages, I recently heard someone say that these are the good old days, that it is only going to get worse from here. And I think that's a really important piece of context to keep in mind as we evaluate the different ways that we can integrate artificial intelligence enabled tools to level up, frankly, maybe the kind of older analytics and digital health IT solutions that haven't been able to realize quite the same, potential efficiencies or, quite the same streamlining of tasks. Healthcare is particularly prone to thinking of, digital health and health IT as analytics and dashboards and other tools that really admire problems. And I'm seeing a lot of artificial intelligence enabled solutions position themselves as really, kind of a tool to solve problems, not just admire and explain them. So, as we, continue in this inflection point as a society and certainly as a healthcare industry around how artificial intelligence makes sense to deploy in safe and responsible ways, there's a need to take a long view, to not get caught up in, AI FOMO, and to really think about strategically implementing AI within an organization that can be in a way that's sustainable, that positions organizations to reap benefits while, managing risks. And part of that is going to be learning how to intake use cases and tools so that you can separate the bold claims and the hype from the tools that maybe are simple AI or just a straightforward application of a generative AI model in just a really useful context, but has the potential to create real value for organizations. And so working with within organizations and with vendors of these tools to develop proof points and identify metrics to measure reliability, I think has become really key and will only become more critical going forward. And then the other piece that I think, this event in particular does such a great job of addressing and focusing on is this question around interoperability and data access. Because central to actually realizing the promise of artificial intelligence is, understanding, frankly, the limitations and the data that we have access to actually develop and use these tools. And these limitations might include, scarcity and access challenges, but it also might just include, quality and sort of fit for purpose questions that we as an industry are still trying to grapple with as we assess our data assets and try to leverage them into these more solutions oriented tools. So, I think it's going to be it's a really interesting time. And as a result, it's going to be a really interesting series of conversations at the event, talking about, real practical frameworks that you can use to separate, the hype from the high impact and try to get your data governance, interoperability house in order so that you can realize the full benefit of some of these exciting new tools.
Absolutely, and we're looking forward to the panel as we'll have 3 health systems, their leaders, really discuss much of what you've shared today, Alya, and then really how are they embracing some of their own AI technologies as well as implementation of the strategies, some of which, again, are still grappling with what solutions ultimately what is hype and ultimately what does have traction. So looking forward to that. Walt, what stands out to you in terms of a topic that you would say really matters most right now?
Well, I'm most excited to go back to basics a little bit, kind of care coordination in the post-acute world. I've been around long enough when that used to be the hot topic, not AI. Now coming back to something that has really kind of progressed underneath the surface while other technologies have gotten the spotlight, kind of in the post-pandemic and the telehealth world. You're starting to see a lot of the larger payers starting to kind of aggregate up platforms. Optum bought NaviHealth, and you have NetHealth bought Kasamba, and Guidewell bought Pop Health. So you're starting to see more of a focus on how to not just coordinate, but also position yourself in value-based care. And so, putting a spotlight back on an area that may have been forgotten and a little bit neglected over the last few years is something that I'm really looking forward to digging in on. Having been involved in DHIS since the beginning, it never ceases to amaze me the breadth and depth of the topics that are covered during the conference.
Thank you, and thank you all for sharing. Just drawing on your expertise and knowledge, as I know many of these and what you've shared today in terms of your own practice as you advise and consult in these areas. And we're looking forward to not only the topics that we've discussed today, but there are 3 others that we didn't have a chance to really delve into, but that will be part of DHIS in September. I'd like to pose a question to each of you, and I'll just open this up to whoever would like to take it first. But as you prepare for this year's DHIS, what are you ultimately looking to gain or seeking to learn as you ultimately will be attending and participating at the conference?
Yeah, I can jump in quickly on that. Like other years, it's education, it's community, it's connection, it's real-time information, and solutioning with our peers in the industry.
Thank you, Doug. Other thoughts or specific objectives or areas that you're really looking to, again, maybe acquire as you enter into the 2024 DHIS setting?
Yeah, Justin, I think for me, what excites me the most about the event is, just coming together collectively and hearing a diverse array of perspectives. We're currently drafting and working on a report around patient engagement, virtual care management, digital health, and I think that this will be the perfect forum to hear some of the current perspectives, new perspectives, insightful perspectives about how leaders in our industry are thinking about these topics.
Absolutely. You and Doug both kind of talked on it. It's unique because we bring 3 unique stakeholders together, right? All under one roof to discuss these, and it is a very unique setting in that sense. Alya or Walt, any thoughts come to mind as you're preparing for this year's DHIS? What your takeaway may be?
Yeah, the thing that I found so helpful last year and I'm looking forward to again this year is just getting out of, kind of my own bubble, right? When it comes to the issues that feel most pressing to solve for or put into context, especially when it comes to a lot of the policy making, frankly, that's impacting the development and adoption of these tools. And being in the room with CIOs, CEOs, other experts from across the community to think about how these more abstract issues are actually impacting their strategic decisions, what they're investing in, which trends are catching on, and which trends are fading into the distance. That perspective is really just invaluable, and I found helps me kind of prioritize what I'm reading and following up on and focused on when it comes to supporting the organizations I work with. So really looking forward to more of that real world experience and kind of perspectives from the operational front lines.
And it's interesting you say that, because we say all the time, a lot of these tech companies are solving tremendous problems, but they don't align even with the top 3, 5, or even 10 priorities of these provider organizations. So important again to have those voices that are actually involved in their strategic decisions of most important or prioritized problems in their health systems. Walt, what about you? What would you say is just standing out of, I want to obtain this knowledge or perspective from DHIS this year?
Well, there's 2 things that always stand out on DHIS, and I'm really looking forward to this year. One is the content is always on point. It's kind of really topical what the industry is thinking about and what solutions are being brought forth that we maybe wouldn't hear at another conference. And the second, which is very unique to DHIS, is that you don't find anywhere else where you get senior leaders from large provider systems sitting down with investors who usually don't talk with these large systems because there's not as many opportunities, but then a new opportunity comes out of it, and they get to compare notes, compare pain points, and say, hey, maybe there's a way for us to work together to solve for the problem or for the pain point.
Absolutely. It is a unique setting, to say the least, to have that many decision makers all in one room over a short period of time. So I'd like to thank each of you, again, not only for your participation today, but for your partnership, your long-standing loyalty, as I think each of you really from the onset have been, or your organizations have been, a sponsor of DHIS. And frankly, I'm really looking forward to 2024 DHIS in September and to seeing each one of you there in Park City. Until then, be safe and take care of yourselves. For more information about the event, or if you would like to register, you may go to the classresearch.com website under the event page, or go ahead and connect with your relationship manager here at KLAS.